Dr. Salman reminded me, some of you are joining us across the globe, so it might be good morning or afternoon or good evening to some of you. My name is Dr. Hala Aboutaleb, and I am Acting Health System Governance Regional Advisor at WHO Regional Office for the Eastern Mediterranean region, which is based in Cairo. I'm honored to join you all today in discussing a very timely and highly relevant global, regional, and national issue. Today, Arab Public Health Association organizes its 10th webinar session on COVID-19 with special focus on private sector engagement and the role. I'm happy I'm going to introduce very soon, after a few points and remarks I want to share with all of you, my eminent speakers for today and panelists. I just want to highlight in the beginning of this session is that private sector definition has been used differently. We use it differently, and it's some of them included the ones for business-oriented private sector, or philanthropic, ignoring the civil society part of it, or the non-profit private sector. So as WHO, when we discuss private sector definition, we try to make it comprehensive. We're talking about all partners, private sector being a stakeholder in the health systems. It's not a new thing, and they are involved in public health rather than in service delivery on its own. It includes, of course, private sector also includes a variety of areas of work in healthcare, like beside the facilities, we're talking about charity organizations working also on production of pharmaceuticals, production of products, different enterprises, and I'm sure we're going to discuss in the coming hour and a half those issues. In addition to this, health system stakeholders and actors, including private sector and the role, COVID-19 brought up the ideas that private sector has applying COVID-19 lens demonstrated the crucial role of private sector in public health, which is beyond health service delivery. Therefore, for countries to move towards health security and to advance towards universal health coverage, we cannot ignore anymore private sector as a key actor in the health systems, globally, regionally, and at a country level. It has a different scale, and there are different ways that we need to understand that in discussing private sector engagement, we need to understand their language and be able to communicate. The state needs to be able to communicate with them in their language. And similarly, the private sector needs to understand the state's concerns and issues. This is very important in trying in a pluralistic health systems now. Even when we're talking about service delivery, we need to make sure that private sector is well engaged in the decision making of health decision making, as well as in public health response. And this requires the state to play a regulatory role, an accreditation role, as well as oversight role. But it's not a matter of control, rather than engagement, taking into account the interests of the private sector and making sure that we sustain quality and health outcomes without harming any businesses. So I'm sure I have more to say and discuss, especially when it comes to COVID-19 crisis and the need for effective private sector engagement, which became critical. There are a lot of issues that have been raised and exacerbated, like issues of access to vaccines, access to treatment, access to medical products, digital health, and how to make sure that the IT is also not is involved now, and which is mainly run by private sector. There are a lot of issues and areas of work and discussions and debates going on. How can we engage with the private sector while protecting the right to health of the people, and making sure that everyone has access to vaccines as well as pharmaceutical treatment in the future, and medical products as well. So I'm very thrilled, and this is a topic very close to our heart. and which requires WHO to work closely to strengthen the engagement of the state with non-state actors, including private sector, with the broader definition, as I mentioned earlier. So without further delay, I'm very proud and honored to introduce our two eminent speakers. We'll start with Dr. Fadi Alame, Member of Parliament in Lebanon, and a member of the Parliamentary Committee on Health, Labor, and Social Welfare. He's also Chief Executive of Sahel Hospital in Beiruit. He will be followed by Dr. David Clarke, my colleague from Geneva, WHO headquarters in Geneva, and he is the team leader, USC Health System Governance and Law. Each one of them will have 15 minutes to share with us their reflections and thoughts and experiences. This will be followed by a panel discussion where I will be joining, with great honor, I will be joining Dr. Salman Rawaf, President of the Arab Public Health Association, and Dr. Tawfik Khoja, Vice President of the Arab Public Health Association, in discussing the issues you're going to raise in the chat box, and discussing openly your concerns and our concerns as well. So over to you, Dr. Fadi.
Thank you, Dr. Hala. Good afternoon from Atlanta, Georgia. I just came from Beiruit 2 days ago, so I'll be addressing this issue from Atlanta, Georgia. Let me start by thanking the Arab Public Health Association for organizing this interesting webinar. And I'd like to also extend my special thanks to Dr. Salman and Professor Khoja, whom I have the pleasure to work with at the Arab Hospital Federation. And I think physically last time we met was back in Cairo in February when I took over the presidency of the association. My special gratitude goes to Dr. Clarke, whom I just met shortly, Dr. Hala, and the rest of the panelists and the attendees. As part of my role in Lebanese private healthcare, with a brief hint of what I'm trying to achieve as a member of the Lebanese Parliament's Health, Labor, and Social Affairs Committee, my discussion today is I think will be broken down into 4 or 5 segments, just to make a case of what the private sector in Lebanon is going through and what needs to be done to support that specific main component of the healthcare in Lebanon. So first, I will start with a brief overview of the private sector versus the public sector in Lebanon. And then I will move on to discuss a little bit the position of the Ministry of Public Health. And after that, I will talk a little bit about the pandemic impact on this private sector. And then we look at the challenges ahead and finally some of the proposed solutions. And I think with my last item, I will be probably talking as a parliamentarian and discussing exactly what we're trying to do to help the private sector overcome the impact of this pandemic. So briefly, let me start with a quick overview with some numbers in showing the role of the private sector in Lebanon. In simple terms, the private sector in Lebanon provides 80% of the services. So 80% of the services offered by the private sector and 20% by the public sector. It has been the case ever since Lebanon got its independence back in the 40s. The government failed to produce a good public health system, and the private sector moved in and invested heavily in that specific sector. And that's what made Lebanon so unique as far as a medical tourism hub. In numbers, to show the significance of the private sector, let's go through the bed capacity. The private sector, as far as regular beds are concerned, holds around 9,500 beds versus 1,879 beds for the public sector. For the ICU beds, the private sector holds 1,972 ICU beds versus 336 beds in the public sector. The ED beds, emergency department beds, 878 for the private sector versus 215 for the public sector. Ventilators, everyone talks about ventilators now with the COVID-19 thing. The private sector has 1,020 ventilators in place right now versus 165 ventilators at the public sector. All in all, you can see that the private sector plays a major role. In fact, it offers a core it represents itself as a core provider of healthcare services because the government failed to produce a strong and healthy public sector. Having said all this, it's no surprise because this is a stand of the Lebanese cabinet at this point, and it's a stand of the Ministry of Health, Public Health. Mainly they're focusing on the public sector now during the pandemic era. And I've always voiced that specific point, even in the oversight committees at the Lebanese parliament, that when you have 80% of the healthcare services offered by the private sector, when you get hit with the pandemic, your focus should be on the private sector, the provider of the major services, and then you complement it with the presence of the public sector. But what the government did is went ahead and focused on the public sector, aiming to be able to contain and to stop the spread of corona virus and to take care of the patients needing admission. And this is where there's a strategical, I think it's a strategic mistake, and hopefully we don't have to pay the price for this in the long term. Now, the government trying to push for the public service is one thing, but the government not having the funds to do so is another issue. Now, not too many people know that probably Lebanon is going through tough economic and financial times nowadays, and the government lacks the resources. So what they had to do is go back to the World Bank and ask to divert one of the agreements on the treaties that was passed the parliament back in 2018, in which $120 million were given in the form of soft loans to enhance and support the public sector in Lebanon. So they had to use $40 million of which and try to support and enhance and upgrade the services of the public sector in order to be able to handle the coronavirus issue. This is, I think this should take me to a second point, which is to shed the light on how the private sector operated and how it's operating now after the COVID-19. The business used to be where most of the hostels in Lebanon operated at about 63-65% occupancy, which is fine, meaning that those specific hostels were able to produce a profit given the occupancy levels. They've always suffered from low tariffs, even when the WHO almost 15 years ago recommended that those tariffs need to be adjusted upward. No single change was done since then. So they've always had to deal with the low tariffs and try to be innovative in their services and in kind of subspecialties and the disease state clinics that they had to utilize in order to hit a certain profit, acceptable profit. And they've averaged about 2 to 15% as far as the profit margins are concerned. So after the pandemic, things have changed. Occupancy levels went down from 64% to almost 40%. Nowadays, as we speak, we average in Lebanon about 40% occupancy rate. And everyone knows that you need at least 55% occupancy rate to break even. So most hostels are producing losses every month on their P&Ls. And we need to add to it also the currency fluctuation in Lebanon vis-a-vis the US dollars. So the official exchange rate of $1 equals 1,500. Now it's $1 equals to 8,000 pounds. And that's making it very difficult during the Corona era for hostels to operate and buy their supplies. With this in mind, so many of the hospitals in the system, the private hospitals in the system, are facing major challenges, including layoffs, offering half shifts for their employees, losing serious talents, mainly nurses, leaving the country, going somewhere else. Balance sheets and financial statements, they're showing they're negative, they're showing losses, which is not helpful nowadays. Government poses another challenge because insofar they have not acknowledged the major role of the private sector, and they continue to insist on enhancing and upgrading the public sector during the midst of Corona. Medical supplies are becoming an issue. When the COVID-19 started to spread quickly, there was a disruption in the supply chain of medical supplies and PPEs mainly. Now add to it in Lebanon the financial crisis and banks stopping to grant overdrafts and loans. So that added more pressure on the Lebanese private sector. Patients are being asked to bear the increase in prices, so they have to come up with a higher co-payments. And yet, on the other side, we have an unemployment of 40%. So not too many people are employed nowadays, which is probably very similar in so many other countries due to the pandemic. A drastic measure that the syndicate of private hospitals took is to announce that it would stop accepting or taking in elective cases and will only take emergency cases, chronic disease cases, chemotherapy patients, kidney dialysis patients, but no major, nothing has been awarded towards the elective cases for now. So we've suspended taking elective cases until further notice. With all this in mind, what we did now, let me share with you what we're trying to do as a Lebanese parliament, and specifically the healthcare committee, parliamentary committee, is what we did is we invited all the stakeholders in the healthcare field, and we met, I think, about 2 or 3 times and came up with a unified list of demands needed for the healthcare system to be able to sustain its services and continue throughout December 2020. So what I will do just now is list the key points that are related mainly to the private sector. And what we're trying to do as parliamentarians is really act as lobbyists for the stakeholders with the other branches of the government in order to make sure that the stakeholders can really handle the impact of Corona. One of the things that one of the key demands is to really produce an instant financial stimulus package all the way until 2020. And that's badly needed by the healthcare sector, private healthcare sector. Another thing that I personally worked on with the World Bank in Lebanon is to see if we can utilize one of the emergency World Bank funds available for the healthcare system and mainly for the private sector. And then here we had a glitch because due to the high risk profile of the private hospitals in Lebanon, the World Bank cannot grant those specific entities without getting the support of a governmental institution. So what we're trying to do is to get the Central Bank of Lebanon to play as the guarantor of the hospitals. Now, the other glitch that we found out that if we're going to take loans in dollars and we have a serious problem in the fluctuation of the currency, repayment in dollars will add more debt burden to the hospital. So now we're trying to find a way to see if we can repay the loans in Lebanese money, in Lebanese pounds, and let the central bank cover that difference. So this needs a specific legislation, something that we need to work on very soon. Another point that they raised is subsidizing the cost of medicine, medical supplies, food, and fuel oil at 100%. Because of the bad economic terms that we have, the government managed to subsidize for the medical supplies and the medicine, 85% at the actual official exchange rate. And they left the 15% for the black market. And the 15% ended up being, most of the times, more than the 85%. So there's a serious demand that the government bears the subsidy and covers all those basic essentials for the private healthcare system at 100%. There's another effort that needs to be done where the government has to push for more discipline by the vendors. making them and urging them to honor their payment facilities that existed before the COVID-19, which is not the case nowadays. There's another demand where the government is being asked to buy the medical supplies strictly and directly from the manufacturers, so we can cut down on the middleman's role and fees. One of the serious demand to ensure proper cash flow is to ask that the payers, the public payers in Lebanon, and they're usually very late in payments and delinquent, is to start issuing advanced monthly payments against factored invoices, so we can ensure continuity and proper cash flow. Another thing is that to get all this in place, we formed a task force to push for those demands. The first meeting is tomorrow with the Prime Minister. Unfortunately, I'm in Atlanta, so I won't be able to attend that important meeting, but that's going to be the launching point for the demands of the private healthcare system to see if we can at least get the system to work and give it oxygen until the end of the year, and then we'll plan something else later on. So I think I'm almost done. Like you said, Dr. Hala, the private health care system in Lebanon is in place, has managed to provide the most needed advanced services in place, but it needs a direct stimulus package. Otherwise, it won't be able to attend to its role. And believe it or not, the Lebanese population has a big trust in the private healthcare system, and they'd like to see this happening. And so it's over to you now.
Thank you very much, Dr. Fadi, and just for raising those important and very transparently those issues and challenges. Private sector in healthcare in Lebanon is not new. It's, as you mentioned, 80% of the services is provided by private services, which actually played a strong role in this trust building you just alluded to. They filled the vacuum. There was a vacuum and it had to be filled. And this is the problem, that sometimes we point fingers to the private sector for filling in a vacuum, which is not, they happen to be there, and people are grateful for receiving quality services when they need to. Strengthening the public sector to play its role is a must, but does not mean that this will compromise private sector. It has to be in a partnership. There should be comparative advantages. Each one can and you raised a lot of issues and solutions that for all of us to think about. So thank you very much, and I'm sure you're going to receive a lot of questions in the chat box. Without further delay, I would like to invite my colleague and friend Dave. Are you ready with your slides, Dave? Can you share them with us?
Can you see the slides, Hala?
Yes. Data show. Can you move to data show, please?
Yes, I will do that right now. So thank you very much. I was very interested to hear about the experience of Lebanon. It actually highlights the experience of many different countries. So I am David Clarke from WHO HQ in Geneva. One of the things that I work on is looking at private sector engagement. And in particular, we're looking at not just how we can strengthen our member states, work with the private sector, but also at the moment, we're very much focused on the topic that Dr. Fadi was discussing, and that is how we can support the private sector itself in relation to providing much needed health services. So what I'm going to briefly talk about today is the whole topic of private sector engagement, because it's a topic which people get confused about. I want to talk about the work that WHO is doing on COVID-19 in the private sector. I want to talk about a long-term project that we've been running for a couple of years, which is a new strategy for private sector engagement, because we think that we need to do a lot better in this area. And then I want to talk about how we can implement this long-term strategy to support our member states, but also to support the private sector as well. As Hala said in the introduction, this is about engagement, not a kind of a top-down control process. So when I talk about private sector engagement, what do I mean? So what we talk about when we're talking about private sector engagement is the meaningful inclusion of private providers the service delivery and mixed health systems. We well recognize that most countries have mixed health systems. We've done some work on this, and we recognize that at least half of health care provision in most WHO regions is in the private system. So the reality is we do really need to be working with the private sector as part of the provision of health services. And for us, there are a number of key domains of engagement. First and foremost, there is very important is the idea of dialogue between the public and private sectors in policy discussions. There needs to be a flow of information between the public and the private system. We need to have appropriate regulatory frameworks in place. I mean, I'm not just talking about command and control, I'm talking about the frameworks which enable the participation of the private sector in the system. We need to have proper funding and purchasing arrangements with private providers. And we found that this is a big issue for many countries in relation to COVID, where they don't have a history of working with the private sector. They simply don't have the financing and purchasing arrangements, which is leading to all sorts of problems. And we really need to think very carefully about how the public sector itself impacts on the private sector and the sorts of goods and services that it produces. So with all of this in mind, we've actually been doing work for about 2 years now on a new way of governance for the private sector. So we have an expert advisory committee, which I look after in Geneva. And with the last 2 years, the committee's been looking at how we can work differently in this space. I won't go into the details today, but this is the kind of the background to our work. So when the whole COVID situation hit, we switched gear. We recognized that very early on that we shouldn't be focusing at that stage on a strategy, that we should be focused very much on supporting member states to deal with the COVID situation and to mobilize the private sector. So very early on, we issued a call to action about this. We recognize that all countries of the world are striving to urgently increase their capacity in relation to the COVID situation, not just for public health services, but also to maintain essential health services. So we recommend to WHO member states that they should look very seriously in private sector engagement. And what did we find? We found that during the COVID-19 outbreak, we've seen a proliferation of private sector engagement worldwide. And this slide summarizes some of the things that we found, but by no means summarizes all. And it's very important because you see as the different countries experienced the different surges in COVID, that many of them actually turned to the private sector to increase their capacity, particularly OECD countries, where we've seen that those countries increased significantly the numbers of beds and ventilators and health workers that they had to access for their response by bringing in the private sector. And we heard from Dr. Fadi at the start about how many beds and ventilators the private sector offer in Lebanon. But it's not all rosy, unfortunately. In some countries, we've also found that there has been some problems. So for example, this is from an article that came out a couple of weeks ago about high cost of private healthcare in India. And what's happened is that the COVID pandemic seems to have further distorted prices, both for COVID-19 and non-COVID care. And for us, that really highlights the need for stronger private sector engagement and to support governments to better be able to work with the private sector to make sure that services are offered at a reasonable price and cost, but also at reasonable quality. Because we really recognize, and we've been working with the World Bank on this, that COVID actually represents an opportunity to strengthen the relationship between public authorities and private health providers. There's been a problem for a long time about taking the private sector seriously in many countries. And we think that the COVID situation actually presents an excellent opportunity to do a better job. And so we're doing a lot of work to think about how we can do that in the longer term. In terms of what we've been doing specifically in relation to the COVID situation, we've been trying to provide as much as we can tailored guidance to countries, because we recognize very much that countries are having different experiences to this situation depending on context. So we spent a lot of time in the early stages.
Dave, can you use the mic, please, because your voice.
I'm very sorry. Yeah, so very much we very much identified very early on in the situation that we really needed to understand what was happening. So we spent a lot of time trying to understand country situations, and then we we have these 3 phases of work that we've been doing. And in the first phase, which is just about finished, we've been trying to share existing resources on private sector engagement through WHO platforms. There are a lot of work, there's already a lot of material out there on private sector engagement, which is really useful and relevant. So we've been sharing that. We're also moving into a phase now where we're trying to respond to country-specific problems by convening expert practitioner panels to help share the information that countries need. And then we're also looking at doing is setting up a virtual coaching support for effective private sector engagement, recognizing that it's very difficult to do technical assistance at the moment. So we're looking at how we can set up a virtual coaching support facility. And in relation to progress, we're making pretty good progress. We've produced a lot of material on this topic already, and I can share with the participants a website where all this material is freely available. We've produced a lot of material which is designed to support countries to work with the private sector, because we recognize that there were some big gaps and there were some big policy challenges. So I'm very happy to share that information. But what we've also decided as part of our work is that we can't lose sight of the bigger picture and the strategy of private sector engagement. So we've actually circled back to where we started, which was this strategy report that we've been working on in relation to private sector engagement. And the reason we've done this is that we found as part of the COVID response work, that the COVID response work is really highlighting the weaknesses in governance systems, particularly in relation to private sector. So we thought it was critical to continue to work on this important topic. And what this topic really is about is supporting governments and supporting new governance behaviours to see if we can make the private sector and the public sector work together to drive the health outcomes that we want. So we've come up with this theory of change, which I won't go into great detail, but the whole idea of this is that we should be managing the whole health system. Well, for a lot of countries, the focus is on the public health system, and we think that that's not the right approach. We need to be looking at the whole health system, the public parts and the private parts. And our focus is on how we can use some specific governance behaviours to help do that, learning lessons well from the countries who already have a lot of experience in managing mixed health systems. And so overall our vision is for a well-governed health system for all countries, where public and private actors can collectively deliver on the realisation of the health outcomes we want, particularly UHC, but also, of course, the COVID response. And what we have a specific set of deliverables that we're trying to generate to help with this, to build better understanding, to foster relationships between the public and the private sector, to give the stakeholders in the public and the private sector the formal tools they need for implementation, such as contracting mechanisms, the ability to share information between public and private sector so you can have patients moving between the public and private sector, just to give you a few examples. Aligning structures to make sure that we can make sure there's a good fit between what's actually happening on the ground and the government's policy objectives. How we can better nurture trust. Trust is very important. How we can better nurture trust between the public and the private sector. The question of trust often comes up in discussions on this, and we have some ideas about how we can do that better. And lastly, we want to support our countries to deliver strategy, because we recognize that many countries simply don't have a strategic approach to a strategic policy on working with the private sector. So we're very much focused on supporting governments to put such a policy in place. And so all of this leads us to some things that we're going to be working on in the short term. And these things are covered by these 4 points. In the first instance, we're going to do a lot more to try and build political will to work in this topic. So we're going to do some work with our partners in the UHC 2030 platform to convene a new working group on the private sector, which will involve key global health actors such as WHO and the World Bank and other people who work on this topic, as well as member states, as well as representatives from civil society. So we can talk together about how we can get this topic treated seriously. We also want to work to support our countries to embed the governance behaviours I've discussed into their national health systems. At WHO, we have a lot of work to do to set better norms and standards in this area, because I don't think we've done enough to date in relation to focus specifically on the private sector. And we're also trying to support learning and technical guidance, both the WHO staff and also for our member states, because some countries really don't understand how the private sector works and don't necessarily have the capacity to work with the private sector and to work with mixed health systems. So we have a series of metrics that we're going to measure ourselves against to try and deal with these issues. I won't go into all of this because I'm very conscious of time, and we want to have a lot of time today for discussion. But what I'd like to do is to come to this slide. So this is like the things that we're going to be doing over the next year in relation to this topic area. And I just wanted to highlight a few things. So first of all, in relation to building political will, we are going to set up this working group on the private sector. And we would definitely welcome the opportunity to work with parliamentarians across the WHO regions on this topic. We're also going to be doing quite a lot more work on training and helping people to understand the topic better. And we're looking at how we can use the new WHO Academy to help member states and also WHO staff to better understand this topic. And responding to Fadi's question about the problem with the financial sustainability of the private sector, we recognize this as a significant problem. And of course, it's a significant problem if the private sector fails in countries where there's a large private sector, because then we end up with a big hole in health service provision. So we're doing some work at the moment with the World Bank on looking at the financial sustainability of the private sector, with the goal of coming up with some policy recommendations for governments and some criteria to help governments to make better decisions about how to bail out the private sector. And we're also doing a lot of other work in relation to supporting member states with learning and technical guidance. I don't really know if I want to get into that right now, because I really do want to give a lot of time for discussion. But one thing I wanted to end on was that WHO really recognizes that this is a big topic area and requires an approach which brings together a consortium of people and organizations to work on this topic. So at the global level, we're very much looking at convening the different global players who work in this topic area, including donors and the international institutions. We're also supporting our member states, and I want to in particular, sorry, our regions, and I particularly want to mention the EMRO region, which has actually led the way in terms of the work that's been done across WHO and the private sector. And we're also very keen to collaborate both with our ministries of health who we support, but also to support ministries of health to work more constructively with the private sector, because we think that the time has come for countries to really be scaling up their response to better managing mixed health systems. And what's really the COVID situation has really brought home is how that we're doing a very good job in this regard at the moment, and that we need to do far better. And even after COVID, we're going to need to have a good long look at how we can use the private sector better to get the health outcomes that we want. And with that, I will finish. Thank you.
Thank you very much, Dave. And your concluding remarks says it all, that how can we better engage and strengthen the partnership between both the public and the private sector, taking into account and acknowledging the diversity and heterogeneity of the private sector as well as the public sector. We're strengthening the capacities, making sure that we're providing technical skills, and making sure that we're supporting the development of policies, national policies and strategies based on country context, respecting the country context, and working with all partners, including parliamentarians. Of course, I cannot summarize all what you said, which is already very rich, and I acknowledge the work that you've been leading in WHO globally, and my colleagues also in EMRO who are leading this along the way. So we need to strengthen the health system governance design, structures, actions, and change behaviors, understanding both the private sector incentives and needs and language, as well as the public sector. So I think a lot of issues have been raised, and I'm very eager, I'm sure so are you, to listen to what's happening in the chat box, which we cannot see. But I invite my colleague and friend, Dr. Salman or Rawaf, if you would like to share with us some of the chat box questions before we move to the panel discussion. Over to you, Salman. Salman, you need to unmute yourself.
Yes, I'm not muted. Thank you very much indeed, Dr. Hala, Dr. Fadi, Dr. David, for very, very interesting presentation. I honestly, I think what you put are quite challenging things. And a lot of questions emerge from the two presentations. I just want to, before I go to Professor Khoja, he got a few questions to shoot with. I think if we, David and Fadi, if we forget all these jargons, you know, because I think people are not have the capacity anymore to accept. I mean, I raise it with my colleagues at WHO on many occasions, both with Tedros and Dr. Ahmed Mundari, you know, that COVID actually exposed a lot of weakness in the way we are thinking about health systems. And I strongly believe the health systems which we have today will be radically changed over the next couple of years. It's proved that health systems are not resilient enough. That at a global level, like WHO, World Bank, etc., didn't do good enough things to develop systems with resilience. And I think the NCD agenda absorbed all the capacities without thinking about acute event, you know. So put that aside, and we need to keep it in our mind that this will be a challenging agenda. I think what Fadi said is actually a very important point, that the government decided, and this is, by the way, not only in Lebanon. Many countries in the region, the government decided that this is a public sector issue. This is a national emergency. And I cannot rely on everyone exist within the system because the governance did not exist. And it's not really watertight in a way that most of the countries, they have they at that time faced two options. Either they take control of the private sector, as they did in the United Kingdom, you know. They did it for two reasons. A, to protect the private sector, and B, which is very important to the system, to increase the capacity of the public system. And I think the slide from David show how the capacity increased, but I think he didn't mention that it was actually to protect the private sector. That was to the tune of about 13 billion, maybe more. That didn't happen in Lebanon. And now, the question to you, Fadi, what are the measures to sustain? I know you mentioned something about moving loan, you know, trying to pass certain laws, which no guarantee it will be passed, discussion with the Prime Minister and the President, you know. What do you think, whether the health system in Lebanon, which is 80% private, will be sustainable over the next 2 years?
I think it's very clear that you need a stimulus package. It's the only oxygen that the private sector is going to get at this point. I'm not sure the government has a problem on its own financially. So I would very much be surprised if the government decides to take over the private sector. I think it has to be the other way around. That was my advice all the way, that we have not succeeded in the public sector. And then now we have a PPP law, the private public partnership law in Lebanon, which was passed in the parliament 3 years ago. And now maybe what we need to do is to really build a more comprehensive health system, is to really invite the private sector or the private investors, I mean, investors to buy into and invest into those public hospitals, take them over and get the private sector to manage the whole healthcare spectrum. This is what we need to do. This is our experience at this point in Lebanon. I have to be very blunt. We have failed. even though the government tried to change the governance structure of the public hospitals 10, 15 years ago, and they work as independent bodies, but that's not the case. Very few of the hospitals have managed to succeed. The rest, they failed. And now, even as they try to provide them with all the logistics and the support, I don't think they're up to par to receive the spike in cases that we started seeing again in Lebanon.
But Fadi, how the government will bridge the gap from patients which disappeared from you? About 40% of your patients are from abroad.
It's another issue that being a medical tourism hub and depending on patients coming from Iraq and so many other countries, even from the Gulf to Lebanon, that's an issue now that we have not been seeing that, but that has nothing to do with the virus and the pandemic. It started with the financial and economic crisis that Lebanon started witnessing in the summer of 2019, and things started going down the drain until we got hit with the coronavirus. So at this point, I have to be, frank. So far, we have not seen a proactive initiative by the government to, hold this health system together and have the system work. The private and the public work together in partnership in order to, survive that specific critical time.
David, I'll move to Tawfik in a minute. David, one of the big issue is the ambulatory care, ambulatory private care, because all of our discussion, the description by Fadi and almost by you and Hala, we're talking about hospitals, and people may think about a hospital is the main subject of discussion here, which is not.
No, it's not.
Many countries felt that the ambulatory private health care should be controlled. Some of the countries, they closed it. Some of it for a long period of time, other for a short period of time. And the reason for that, because the private sector, ambulatory private sector, started to see COVID patients, and any patient leaving home as a suspected case or indeed with symptomatology, possibly the journey from home to the clinic, that mean almost another 10 people infected with the virus. And therefore, these were important public health measures to keep people at home rather than encourage them to visit ambulatory care. Sure. What do you think countries should do in this case?
Well, I mean, there's a balancing act, really. And you're also seeing now that as a result of the private sector being prevented from seeing patients, that there's now a big backlog of people who have been receiving care for other conditions, which is another wave of problems. But I think the other interesting thing to think about, and it's obviously relevant in some countries and not others, is how we can better use technology. I mean, this is another thing that we're really seeing. In some countries, the use of digital technology has taken off because of this situation. So in some countries, people are using a lot more telemedicine to avoid people having to travel to ambulatory facilities and to avoid the situation that you mentioned. So I think it really is something we need to look at very carefully. I mean, the other thing that your example brings up is the point I was making in the presentation, that we really would encourage our member states to look at how they can work with the private sector in those circumstances. So what we've heard from the private sector in some countries is they haven't necessarily been supported to provide things like personal protective equipment. They haven't necessarily been supported with kind of clinical guidelines and been supported to be part of the response. So I think there's a lot to do still to address this issue. Obviously, ambulatory facilities do provide a really valuable service to their populations. And I think there really is a balancing act here in relation to how we can make sure that we don't expose people necessarily to COVID, but also maintain essential health services. And this is something that I know that WHO is doing a lot of work on. So and continues to do so and continues to review the situation. So it's a very complicated situation, unfortunately.
But I mean, here we're talking, David, about public health issues, i.e. minimize population movement. And I think in some countries, because of lack of governance, because of lack, even I dare to say, ethical behavior of some of our colleagues, that was an important public health measure to close these private clinics.
Well, I think again, it's a balancing issue. So in relation to COVID, I think we have to remember two things. We're not just talking about the immediate response to COVID. We're also talking about the maintenance of essential health services. Women still need to give birth. People still need to get vaccinated, and we're already seeing the consequences of those services not being provided. There are predictions about the big wave of health problems that we're going to see post-COVID because those services are not being provided. So I think it isn't just a matter of looking at the public health response. I think it's also thinking about how we can appropriately and safely make sure that people continue to have access to essential health services.
I'll come to the balance. Professor Khoja, any to you on your questions?
Thank you so much, Prof. Salman. Thank you, all of you. And really, I enjoy the presentations. I have a few questions. Let me start the two, one for Dr. David and for Fadi. The first one, do you think that the private hospitals were ready for such pandemics? If it is not, this is my feeling. What are the requirements for such preparations? This is a question came up. As you see that the private sector in Saudi Arabia, almost like 25% in Saudi Arabia is private sector. And for the engagement of the private sector in this pandemic. So what are the preparation and the requirements to make the private sector in the future ready for such pandemic or epidemic? For Dr. Fadi, there were human resources workforce shortages, specialties, especially in the ICU people and other departments of the hospital, like the emergency. How can the private sector compensate for such national shortages? David.
Just to say, yeah, that's a really good point. In fact, what we did early on in our work was to do some research. We did a survey of countries to look at what the policy challenges were. And we found out that the situation you just described is exactly the situation. In many countries, the private hospitals weren't ready because they weren't well integrated into the health system. And I guess one of the key points I wanted to make in my presentation is that post-COVID, I think we need to look very carefully at how we can better integrate the private sector into the health system and how we can make sure that they have the tools that they need to be able to play the part in response. We found very early on that the private sector was saying to WHO that they had to access personal protective equipment. They weren't necessarily getting information from the public sector about how they could work on the response. So I think this whole situation really does highlight that we do need to do far better to make sure that the whole health system, not just the public system, is ready for the next pandemic.
Yes, but if you see,
sorry.
Investment. I mean, the private sector is a national investment. If we have 100% government pay for the health sector, done for the private sector. So this is a big amount of money. I mean, the issue. What do you think, as an expert person, how can we engage this sector in real life of pandemic? This is the issue.
Well, I mean, it's up to each country to decide how best to use its private sector in relation to the pandemic response. But we have seen countries taking very different approaches. So right at the start of my presentation, I talked about what's happened in countries, bring the private sector into the response, where the United Kingdom, for example, which was an example we talked about, they use their contracting mechanisms to bring the private sector into their response. And so did a number of other countries as well. And we're also seeing countries in the low and middle income countries doing exactly the same thing. For example, we've been looking at what the Philippines have been doing, and they because they have a very good contracting system as part of their social health insurance scheme, they were able to convert that system into a system which allowed them to bring the private health system into their response very quickly. But many countries don't have the mechanisms to do that. So there are some big gaps around, not just around making sure that the private sector has the equipment it needs, but also big gaps in relation to things like contracting and reimbursement, which is something we're also looking at the moment. So we're doing some work at the moment to try and support countries who do want to contract with the private sector as part of their response, but don't have a history of doing so, to provide them with some active support in that area.
Okay. Fadi, second question from Professor Khoja.
I think Professor Khoja mentioned how we can be better prepared to compensate for the losses of manpower. I wish I have a straightforward answer during the pandemic. I think at this point, what we need to do is really try to incentivize the workforce to stay and to perform and to work and to protect them with the proper PPEs and everything, so they can, do the job they're supposed to do. I think post COVID-19, I think we should go back and review our policies, have better surveys and planning of what we need as far as manpower is concerned in the healthcare field. I think the major issue we suffer from in Lebanon, and it's probably across the spectrum, it has to do with the shortage in nursing. Not too many people there aware or oriented or educated about the role of the nurses and how important they play in the healthcare setup of any given healthcare setup. So I think that we have to come up with policies in place to educate from the high school level onward, and to also probably come up with certain scholarships to get those interested in joining the nursing schools and to graduate, and hopefully find a mechanism and a strategy to keep them in place and not to lose them, because most of the times, due to the low pay, they end up going to other countries for that. So that's the main issue, but I don't think we can address it now. Now what we need to do is maintain what we have, stop the loss and protect the workforce, and then look into different strategies to build up a more reliable workforce.
I think the issue of nursing, Fadi, is global, actually.
Yeah.
I don't think any country in the world can say that I'm secure with the nursing workforce. And I think we collectively around the world failed to attract sufficient number of nurses, to reward them, and to retain them in services. We couldn't provide flexibility in the working hours and the issues of motherhood, parenthood, etc. All these are very complex factors, and I would say at global level, we have failure. I mean, I know we have a set of questions which I will visit from the screens already appeared in front of me. But I think there is one crucial issues about balancing between private and public in any health system. I mean, Fadi, you said you are about 80% compared with the 20% public. I mean, the COVID story now unfolded so many things. Is that the right balance? I mean, I just want to ask you, Hala and David, and even Tawfik, my friend, because he is involved in that element of health system in the 6 GCC countries for many, many countries, a rich experience. So is that the right balance? Let me tease you here, Fadi. I think that is a fatal balance of 2080. It should be the reverse. What do you say to that? I'm not teasing you. I'm the devil advocate here.
Okay, may I jump in, Salman?
You want to jump in here? Come on.
Yes.
Come on.
I mean,
is that the right balance?
I wouldn't say, but there's nobody can say right or wrong balance. It's a country context, as they were saying and Fadi were saying. Actually, they proved more that this is the idea is how to make sure that this is what WHO is calling for. COVID-19 made it very clear. We need a whole government and whole society approach, including private sector. The role of the private sector, it depends from one country to another, depending.
But Hala, they didn't. Hala, you say that.
I tell you.
But they didn't.
I allow you. This is, by the way, even in the most mature health systems, even in the UK, in the US, nobody did. Why? Because we were not prepared. It's not a WHO problem, World Bank problem. Countries were not prepared. Nobody thought of the magnitude of this blow. And no system, however mature it was based on public sector, was able to stand and support the magnitude of this shock that health systems were subjected to. The idea, thinking, what are the lessons learned? I would say, instead of what's the right balance, I would like to pose it differently. What are the lessons learned? What did we observe from globally, from countries and from the region and countries? What are the lessons learned and how can we learn from it? Because as they were saying, there is another wave coming. Are we prepared for it? Did we learn our lessons? Are we really engaging? Are we going to repeat the same mistakes, or are we going to be prepared, taking account the private sector is a key actor? And by private sector here, I mean profit and non-profit.
But
both even civil society networks. I'm not talking about, just to give me a moment, please. It's not only service delivery. We're talking about production of protective equipment. We're talking about respirators. We're talking about digital health and how can we use it for online and telecounseling to make sure people are getting their services and counseling they need and the continuity of essential healthcare. There are a lot we learn globally, and WHO and others and countries learn. I think that the question would be, how can we use and capitalize on the lessons learned? And Fadi was saying that the public sector started and tried to address the issue solely alone, and then they brought in the private sector. Are we going to continue repeating the same mistakes, or are we going to be better prepared and push for a whole government and whole society approach in the decision making on what are the actions, what needs to be done? This is an opportunity, Salman, for health systems globally to reform, to be better resilient, as you rightly mentioned, to be better prepared. This is an opportunity for us to build the systems in better, keeping the right balance, which countries will decide. If a country, this is the right balance, this is something to be dialogued, and we should support policy dialogue at country level. We shouldn't be sitting here behind our screens and discussing it. This is in my opinion. Over to you, Salman.
Thank you very much. I mean, it's nicely said, but I mean, in practice, it's different. I mean, David, what do you think that balance should be? Because even in the United States, which is the most free market in the world, the balance is state, federal is 60% and private sector is 40%. So in the United States, they didn't need much of the private sector because although our impression is totally different. But what do you think the right balance should be?
I don't think there is one. I think it's really down to individual countries' needs and circumstances. And at WHO, what we do is we're working with countries in the situation they're in. We're not saying to them you need X percentage public, X percentage private. We're saying, what have you got now, and how are we going to make sure that your public and private sector work together to produce the health outcomes that you need? So we're very much focused on health outcomes. And in some countries, the public sector might be doing a bad job. And in some countries, the private sector may be doing a really good job. And so we're really, really focused on how we can achieve health outcomes. And in my team, we're very much focused on universal health coverage. So we're focused on how we can increase access to health services for everybody. And in many countries, that will be public and private providers providing that access. How we can improve quality. And we have quality problems in the private sector, but we also have quality problems in the public sector. So we need to address that. And we need to address this whole issue of financial protection and making sure that people aren't impoverished by seeking healthcare. And and obviously that's a big issue in relation to the private sector in many countries, because we're talking a lot about out-of-pocket payments. So there is a big, there still remains a big health financing agenda to make sure that people can afford health services. So I don't think there is a right mix. We're very much focused.
So we have now post-COVID, David, we need to think of one. Fadi, do you think the lack of a national tariff possibly contributes to this huge difference between public sector charges, sometimes free of charge with the small co-payment, and the high prices, different prices in the private sector? Because there are certain countries, which I'm aware, including mine here, there is a national tariff. You cannot charge, whether you are in a private hospital or public hospital. For the insurance, for example, it's exactly the same price. And for those who wish to pay out of pocket, it's exactly the same price for the same procedure based on 6 bands.
I think the pricing issue is not the factor now. I mean, with the bias in services and the imbalance of services between the private and the public sector, it's mainly about the national policy, whether we have access to care all over. We've invested so much in the primary healthcare system. So we're working on the universal health coverage plan, and we haven't succeeded in passing that out, but that will solve also the pricing issues. And but that's not really the issue at this point. What we need now is a type of a quick, efficient reimbursement in order to carry out the services needed to cover and treat the patients that got ill with the virus. Maybe after that, a good solution, like Dr. Clarke mentioned, that maybe we need to have universal coverage, and that's going to solve the issue, because it's going to be the public and the private sector. They need to join hand in hand and start taking in patients, compete against one another for a better service, better quality, and then patients will be very satisfied because they're going to have that access no matter where. So that's the point, really. It's what he mentioned is the right thing to do, is universal health coverage for now. We'll set standards, and then that should really bring competition in place and boost quality.
Which we look forward for that. And if that is I'm sure this is the right way forward, and especially if we can bring both system and the same governance, and without bias toward any part of the system. Charges are the same, quality of service monitor as the same, and it actually is happening in some countries. You don't need to reinvent the wheel, simply just visit these systems. We have a question from Dr. Ali Al-Musawi. By the way, we have some questions. People say, don't mention my name. He said, the problem, if we close private clinic, the patient will not have a choice other than hospitals, which is for certain, they are more dangerous. He put the word sure, I use certain. So are hospitals a dangerous place for COVID patients?
Okay, this is, I will not respond directly to the question, but I wanted to continue what Fadi and Dave mentioned. And maybe this will help you answering this question. Just allow me for a second. The idea is that universal health coverage will not happen on its own. We need to strengthen the health system's governance, as you rightly mentioned, Salman. Who is going to play this steward role to set the standards, manage the health financing perspective of universal health coverage, contract, purchase from the private sector or public sector. It depends based on quality. Who's going to have the oversight? Who's going to regulate? These functions are very important. And without making sure that they are set, universal health coverage will not happen. Going back to this question and trying to answer it, it's not a matter of hospital being safe or not safe. Now we will learn one thing we learned from COVID-19, and I invite Fadi and Dave to respond, is that not all cases that need to be hospitalized to start things. And there are other non-COVID diseases that are need to receive care as well. That's why one thing we learned from COVID-19 is telemedicine and online counseling. And besides, of course, the precautionary prevention measures that should be taken in place, which requires protection of the workforce to start with and infection control measures. It's not like we can criminalize hospitals to being a bad place. There should be standards and measures, governance measures, to make sure that the hospitals are safe places, and making sure at the same time that the ones who need to go to the hospitals are the ones who should be going there. Other cases are receive treatment at home or through primary health care. Primary health care has not been, we're calling for primary health care to be the center of care, to play a role even in COVID-19 response. And through outreach services, through different channels, primary health care channels, through engagement of the community. And you are an expert in primary health care. That's why it shouldn't be jumping to hospitals. Cases who are eligible for hospital care, who require ventilator, ICU, and respirators are the ones who should be going there under precautionary and infection control measures. This is not debatable.
I'll come to this point, Hala, but I want to ask actually Tawfik, Prof. Khoja, do you think hospitals are a dangerous place, more dangerous than ambulatory care clinics in the private sector? You are the guardian of the Arab hospitals. Unmute. You are muted, Professor Khoja. Yes.
This is a very dangerous question. But
it's from Dr. Ali Al-Musawi.
Okay, this is with great honor to you and to everyone here and Dr. Al-Musawi. This is has been addressed so long ago that the hospital is a dangerous thing. And there was so many boxes and so many articles on this in this regard. The patient safety issue came up as an issue that every 10 operation there is a mistake and there is a malpractice and so on and so forth. And this is in very well established healthcare system like in UK and Germany, France, and so on and so forth. And if you see the study conducted by Sabal Khusus and the rest of the group in EMRO about the hospital patient safety issue, you will find there is a range from 15% to 35%, and this is it shows that really the hospital is a dangerous place if it is left alone without strong auditing, accreditation, and putting the for work and standards. So this is an issue. The question is for the COVID, I think they are not ready. Prof. Salman, they are not ready for such a pandemic. This is a public health issue, and this is an epidemiological problem, infectious disease within the community. So you need to reorient the hospital staff about how they can enroll in the public health issue. And for this reason, the GCI and the ESCWA, which goes to accredit the hospital, now they are changing their standards and they are putting new standards to make sure that the hospitals, they fit for the purpose, not only within the boundaries of the and the walls of the hospital, but also within the boundaries of the community and in the public sector, I mean in the public areas. So from my experience in accreditation and so on and so forth, we miss this portion. And I think Dr. Fadi, as he's the chairperson of the Arab Hospital Federation, here that we have a gap in the role of the hospital in the community-based activities, in public health issue, in infectious diseases and pandemic epidemics within the community. So it's time now that the Arab Hospital Federation should take the role and the leading to bring up the standards and the requirement that to make the hospital more safer for places for pandemic and epidemic. And this is my quick answer, Professor.
Yeah, thank you very much. And before I go to two important questions, one from Naim Al-Qasir and one from a person from Egypt saying, don't mention my name on prescribing, Naima, on nursing. I think, Tawfik, you said we are not prepared. And you are right. But a country like Hong Kong is well prepared. You know, every one of us, you know, we used it as a model in tackling COVID-19. Why? Because we said they have fantastic experience with SARS-1 and they have fantastic experience with MERS. As you know, Hong Kong exposed to both, okay? Today, Hong Kong saying our health system will collapse. We cannot cope with the surge of the cases in Hong Kong. So how can you explain the preparedness? You know, I mean, these I'm just trying to say to colleagues and our audience participant that the term of preparedness, we need to look at it in different way, honestly. Again, this is one of the lessons. I'm one of those academic, sometimes puzzled with this one. And despite of my vast expertise in health system, and I'm now thinking about health system in different way. And we have to have a radical approaches to health system. That's why I said to David, everything he said, all these lovely jargons may not be applicable because in the field, we have totally different approaches. My comments, I want to take these two questions. One question from Egypt saying,
Prof. Salman,
hang on, let me take the question, I'll come back to you all. I think the question is, and you can't participate, that the private sector is prescribing a lot of medication which are not authorized, not sanctioned, even not acceptable, simply for profit. I don't know whether this is about Egypt or the rest of the world. Is the private sector responsible for misusing prescribing as a mean of making profit, Fadi?
Yes, definitely. The question is legit, and it's happening, I think, across the board. And it has to do with governance, and it has to do with oversight. If you need to control the way the private sector behaves, if you're gonna leave it up to the private sector, they have the tendency, and they're profit-oriented, and they might go all the way to abuse the system and try to benefit from it. So
even during COVID, even during this crisis, they want to make a profit.
True, it happens. So I think this is the role of the government, the role of the public policy, making sure that you have oversight, making sure that hospitals are being audited periodically, and there's a system in place to ensure that they forget their profit motives and focus more on the humanitarian role that they're supposed to play in. So again, based on my experience, it depends on how strict and how disciplined the governments are in dealing with the hospitals and making sure that they do not abuse their role and take advantage of certain situations like now.
David, where is the solidarity if the private sector try to profit during a pandemic, which is creating so much fear, changing the social fabric of our societies everywhere, affecting our economy, yet small people who are supposed to be the angels saving our life, profiting from this? Where is the solidarity?
I think you're seeing a very complicated picture because, as Fadi said, in some places, the private sector are profiteering. And it's up to governments to do something about that because they're not going to regulate themselves. And a really good example of that is the whole issue of the cost of COVID tests. So in some countries, they're free. In some countries, the governments have controlled the cost of COVID tests imposed by the private sector. And some countries, they haven't. And in some countries, the private sector are charging a heck of a lot of COVID tests. and that's something that needs to change. But you also, I don't think it's fair to say that all the private sector are trying to profit from the whole situation.
Nobody said all.
But what we're seeing as part of our work is that a lot of the private sector players are actually coming to the government and saying, we want to help. And of course, they want to be paid a fair price for their services. And that's another issue, how we determine what a fair price is. But in many cases, the private sector have led the way in relation to try and support the government in relation to the COVID response. And we've worked with a couple of countries where the private healthcare federations in those countries have got together and come to the government with a plan and shown the government how they can support the response. So I think in some cases, yeah, there are definitely issues here about regulation, but there are also definitely issues here about the private sector themselves actually coming to the party to help. I mean, the private sector and their families are just as affected as anybody else by this situation. And we are seeing that a lot of private providers are stepping up to the plate to support the government in relation to the COVID response.
Tawfik, from your experience, Prof. Khoja, did the private sector in the Arab world actually went to government and say, we are ready, let us help you for nothing or something?
I could not have, I could not recall any hospital in the Arab world mentioned in the newspaper or in the media or social media that they are saying that we are going to do something for the government free of charge, or we are ready to do this one. But I heard and I read from the in the press that some hospital in Saudi Arabia, they donate some of the wards to the government, and certain percentage of their income to reduce the cost and so on and so forth. And this is in Jeddah, in Riyadh, in Asir, and so on and so forth. But not because at the end, the private sector is looking for the profit to run the business. My point, they have to understand that the role now during the pandemic should not look for the full profit. They should look for profit which can manage the hospital and run the hospital smoothly, not to I mean, take the chance that the government, that they are in crisis and they are in emergency, so let us take the piece of the cake for us. And this is a serious issue. I remember there was one during the COVID-19 test. They said that in Saudi Arabia it is 2,500, where in United Arab Emirates is 750 dirham. In the same test, how come is this? Then the hospital tried to explain why the difference, but at the end they bring the to the real price it should be. So this is the issue.
They don't function under one governance. Hala,
yeah. So what I am saying, Prof. Salman, that it is the role of the government to put the rules and the to make sure that the private sector, as you said in UK, there is a charge for everything. There is a fee for everything in the private sector, and the government should do this for everything. And this wasn't. When you make it free, so every hospital doing their own business according to their wish. And this is again why the private sector, they are hospital private sector, they are not engaged in public health issue. Yeah. There's no profit in that public health issue, and health promotion and health education. And this is the time we should stress in the Arab Hospital Federation the importance of putting standards and indicators that hospital is engaged in public health dimensions. Thank you so much.
Thank you very much. Hala, is there any good example? Professor Khoja gave us one good example from private hospital donating to the government and supporting the government initiatives in a very rich country. Is there a good example from
Where there are multiple, actually, the private sector is already, there are multiple examples I can remember, just to mention a few, in the production of vaccines and medications, treatment. For example, in Egypt, the pharmaceutical companies are already joining forces, and they are working with in the production to make sure that they are ready to start the production, not only at the national level, but at a regional at a regional level as well. Many
we don't have a treatment, we don't have a vaccine yet.
No, there is already trials now, and there is now an infrastructure that needs to be in place to make sure that they are ready. And some of them already had signed MOUs to be able to manufacture once they are. I'm talking to the vaccine, the Oxford one.
Once it's
and
available.
The Japanese, yes, yeah. And also treatments. There are protocols, regimens that are proved and have been adopted by the government and others. So I'm just talking. There's the pharmaceutical perspective. There's also, when we're talking about the IT services, we're talking about the private sector is engaged. Many actually, for example, there are many, like in Jordan, there are a lot of private sector hospitals who actually offered to host the isolated cases free of charge. There are actually not only health facilities, there are also private enterprises and non-public institutes which open their doors to be able to have like field hospitals built in. So there are a lot of examples of how the private sector is joining forces with the public sector. Yeah. This means that once the public sector opens the door and starts to listen, the private sector is ready. It's how to engage, how to understand the language, and how to have a win-win situation, and to play a strong governance role to be able to regulate and the private sector, which is profit and non-profit. This is key.
Thank you. Sorry, Hala, I have 3 minutes, which I need to capitalize on a few questions. If I can squeeze question with quick answers from Naim Al-Qasir about how nurses could be brought to the table of the top table of governance to ensure that their role is actually vital. Fadi, you mentioned the shortage of nurses. If you bring them at the top table, would they have better role?
I think they need to be involved in decision making, and they need to be compensated for their role. Again, but it all starts with awareness and understanding of their pivotal and important role that they are playing in the healthcare system.
David?
Well, for us, I mean, a big part of our work is to try and convince governments to do more in this area, because I mean, the private sector topic is not a new topic. It's been around for a long time, but it hasn't necessarily been taken that seriously, and some governments have been really reluctant to take it seriously. And we're definitely going to be advocating going forward for a stronger approach. So, for example, one of the things that we're doing is having a new World Health Assembly resolution on this topic.
I mean, I personally want to see actually colleagues from nursing side to be at the top of management of hospitals, as happened across Europe. We don't need doctors to manage hospitals, frankly speaking, unless they are trained in management. They are poor managers, generally speaking. I'm responsible for this statement, and I want people to shoot me. I think we got one question from Amal Hassanian that will be the last, and I have a few seconds for this. Is the role of the epidemiologist is not recognized at the hospital level, especially in terms of patient safety, especially non-clinical epidemiologists, which we have many. And I think this is a very legitimate question from Amal. And I think hospitals, some of the good hospitals, which I'm aware, they have rely on public health people, because that element of analysis helping the better management, helping the governors to be more effective. In the last few seconds, let me thank you very much indeed. Hala, Fadi, David, and on my behalf, Tawfik, and the entire Arab Public Health Association. I wish everyone with us today, and those who are not with us, they couldn't make it, a happy Eid. عيد مبارك وكل عام وأنتم بخير. Inshallah, the next 2 sessions, we are not going to stop. On the 5th, our sessions will be on the role of the media during the COVID pandemic. And we invited 2 giants from Saudi Arabia and Iraq to talk about that. On the 12th, we have a session on public health competencies and what was the gap during COVID. I invited the president of the public health, faculty of public health in England, and Dr. Sheikh Mohammed Al-Thani to talk about this gap in public health evidence. And on the 19th, we have the session on cancer during COVID. I think Fadi mentioned it, David, that people couldn't receive the services they need because of the fear and also the decline of the provision. Thank you very much. Good morning, good night to everyone.
وعيد سعيد مبارك على الجميع.
Thank you.
Thank you very much.
Bye-bye.
مع السلامة.
Bye-bye for now.
Bye-bye.
Bye-bye.